So I'm here. My name is Anita Chan, and I'm here with Tom Appleton. He is a rheumatologist that works based from Toronto. Hi, Tom. How are you?
I'm doing great. How are you?
Perfect. So let's start by asking, can you tell us a little bit about yourself and how you're involved in the field of rheumatology?
Sure. So I am a rheumatologist. I am also a clinician scientist, so I'm involved quite a bit in rheumatology-related research. So in addition to seeing patients with inflammatory and rheumatic diseases, I also do quite a bit of work in basic and translational medicine with osteoarthritis in particular, which is my key focus area. So I have a lab at Western University and also see patients at St. Joseph's Hospital in London.
And from St. Joseph's Hospital in London, what is their specialty there? Can you tell us in relation to arthritis?
Yeah, so I mean we have quite a few different areas of expertise. London is a big surgical center as well, and so we have expertise at the hand and upper limb clinic, where people from around the world come for hand and elbow and shoulder surgeries. But in the rheumatology center, we have quite a bit of expertise in connective tissue diseases like scleroderma. We have expertise in myositis, as well as psoriatic arthritis, ankylosing spondylitis. Of course, lots of rheumatoid arthritis research goes on there as well, and we participate in a lot of the national and international patient registries, including those for rheumatoid arthritis and for lupus. So we have pretty much the full spectrum of all the rheumatologic areas covered.
And how has, you mentioned you're an assistant professor in rheumatology as well?
Correct, yeah.
So over the years that you have been professor, how has the education in the field of rheumatology changed over the last 20 years?
Yeah, so I mean, I'm younger than a lot of my colleagues in rheumatology, but I've certainly talked to a number of people, and it takes quite a bit of time to become a rheumatologist, so I've seen education over a couple of decades span at least. So I think some of the things that we've really seen change is we see much more of a focus on patient-centered care, and that's been really refreshing to see. And rheumatologists, I think, are some of the best at becoming very focused on patients and what their needs are. So we have a long history of involving patients in academic research and in community-based initiatives, and I think arthritis patients overall are very involved and vocal and motivated as a general group, and so it's a delight to work with rheumatology patients. So that's one major area that I think has changed a lot in very good ways. I've also seen a big shift toward a focus on incorporating evidence-based medicine, and rheumatology is a relatively young specialty compared to some of the more traditional ones. And we've been developing quite a bit of evidence with randomized control trials for treatment, and also large patient registries that give us an understanding of how best to make diagnoses. And so that's becoming incorporated in the curriculum, and I think it's very exciting to see that.
And for those of us in the audience who doesn't know, what is evidence-based medicine?
That's a great question. So, for many, many years, physicians were sort of the holders of knowledge and made decisions based on their experience and their exposures that they'd had, and it was very, experience-driven. We know that there are some limitations to that, and so in recent decades there's been a big push to start taking medical decisions to the level where possible, where there's experience that's brought together through studies, through trials that are done that have appropriate controls, and putting more of a scientific rigor to it, which typically results in much more reproducible results for patients, and it helps us to make the best decisions possible, not just based on our own experience, but those of thousands of patients and many different practitioners. So we think that and believe quite clearly that this is a major advance in the treatment of patients with rheumatologic diseases.
And you mentioned before that the rheumatologist, the field itself, it takes a long time to complete the study. And we've also heard that from a patient standpoint that the rheumatologist to patient ratio is very low. There is there's lots of patients, but not enough rheumatologists. What can patients and the community do to attract more interest in the field of rheumatology?
Yeah, I think this is a great question. I mean, I think anything that can be done to improve the situation. I mean, rheumatology, as you say, is very underserviced, not just in Canada and certainly within North America, but also in Europe. And we're seeing major changes, and we expect that rheumatology as a field, which is dominated by a lot of leaders, but therefore a lot of senior people, there are going to be quite a few changes over the next decade or so, with lots of people retiring. And so this is a major need area, and I think we as the current rheumatologists need to be doing as much as we can. But if members of the community can also help to advocate for more rheumatologists going into training, this would be great. One of the areas that we struggle with the most, when we're underserviced, is that we tend to get expertise, rheumatologists being centered in smaller clusters in the big cities. And we don't have great distribution and coverage throughout all of the areas of Canada that are more rural and more remote than we'd like to be able to. And so, if patients and community stakeholders can advocate to those who they know who are currently in training to come to their communities, see what it's like to work there, think about having a career. Rheumatology is a very portable specialty. It's something you need an office. You don't need a whole lot else in terms of equipment. It's something that you can actually practice out in areas that aren't necessarily metropolitan. So, this is something that could be done to help improve the distribution of the rheumatologists that we do have. And then, rheumatology historically has been very, sort of an afterthought, if you will. I mean, I think rheumatology is a tremendously fascinating area, but there may be some misperceptions that rheumatology maybe isn't as high impact as some of the other specialties. And even though that's certainly not the case, it takes time to get that message out there and work to fight against those kind of myths. So I think that's something that all of us can do, including members of the community and patients, to say, this is a really exciting area, and we think this should be an area of focus. Call your MPP and tell them rheumatology is really important, and we need to support arthritis. We need to get more people trained through the medical school systems, and we need to get more people enticed to go into that specialty and provide care for our patients.
And coming to this conference, I know the conference is still going on until Saturday, but what do you find as the most exciting and important thing from this year's meeting so far?
Right, so the Canadian Rheumatology Association is very progressive organization, always trying to make changes. So I think there's a lot of great things that I come and see every year, and there are a few staples. Right now going on is the great debate, and that's always fun and interesting. But this year we've incorporated a few new topics. One of the big things is the new career fair, and so we were talking just a little bit ago about how we have a distribution issue with getting people moving around Canada and providing care where it's most needed. So we had a career fair today, which is a new session, and people have a chance to talk to those in other communities and find out what it might be like to practice there. So that's great. We have a new Meet the CRA expert session, which is an opportunity to talk about practice development and talk about quality improvement issues. So that's a new initiative that we're doing this year and seeing how that goes. So that's exciting. And we've also got the other meet the CRA experts through the Canadian Rheumatology Association, ORA, Ontario Rheumatology Association Alliance, the Arthritis Alliance of Canada. So there's a lot of things going on that are new, and we're trying those out, and excited to see how those go.
We actually interviewed someone named Victoria earlier, and she was involved in the clinical pearls from yesterday.
Okay.
And she was mentioning about the career fair, and she's just first-year resident, so she's really excited about that. So in terms of social media, how do you think social media plays a role in patient care and medical research now?
I mean, patients are really vital, you know, so myself as a clinician scientist, you know, I'm particularly interested in translational medical research, and that doesn't happen without patient involvement. You know, we rely very heavily on the generosity and time of patients to be involved in registries, to fill out the data collection surveys that we ask them to provide us with that vital information, and then that's the exact information that we use to start drawing conclusions about how best to diagnose these diseases, how best to stage them, and also to look for new targets for treatment. And we've seen significant advances because of the involvement of patients over the last 2 decades in particular. And you know, as I say, we wouldn't be able to do that without patient involvement. So I think it's critical, and I'm always so delighted and impressed to see how enthusiastic patients are to get involved. Constantly I'm asked, you know, hey, if there's anything that you've got going on, any trials or whatever, let me know, call me. And I think that's just fantastic, and I want to try to encourage as much of that as possible.
So everyone's going to start calling you later. So in terms of treatment, where do you see arthritis treatment and health professional training in 10 years from now?
Well, I think one of the most interesting things is this new focus on sort of personalized medicine. It's a bit of a buzz term that's going around, but it has meaning, and you know, I think the focus on trying to look at individual patient characteristics, trying to figure out what might tell us that one patient might be a responder to a specific medication, whereas another person who's got the same disease and otherwise looks to be, you know, very similar, might not be a great responder to that medication. And I think that's where a lot of research is aimed right now, is trying to figure out, you know, if you've got 10 patients with lupus, you know, which ones are going to respond best to treatment A versus treatment B. And so I think that'll be a big shift. I also think that osteoarthritis is going to become a much bigger story in the next 10 years. And you know, obviously I'm biased in terms of this being my main focus area for research anyway. But I do see that being a newfound excitement in the field of OA research. So.
Okay, perfect. And we will end with an osteoarthritis question for you then.
Sure.
After the announcement. So what lifestyle tips do you have for someone living with osteoarthritis in terms of like exercise, disease management, whatever? What would be your expertise?
Sure. So, you know, and I think the same can be said for almost anybody with any type of inflammatory arthritis, but certainly for osteoarthritis as well. You know, what I always tell my patients is, you know, 3 things: to be social, to be active, and to be balanced. These are things that are easier to say than to do, but you know, getting out and being an active member of your community and spending time with friends and family is really important for helping you feel good. So I think that's something that needs to be emphasized. And being active, as we heard from, you know, Jonathan Fowles earlier in this meeting, and the focus on exercise as medicine. You know, I regularly prescribe exercise for my patients, and I feel a lot better about doing that now, having heard Jonathan's talk. But it's absolutely true. People they respond better to medications after having exercise, and they certainly have less you know, disease activity with exercise. So that's something that needs to be focused. And then the balance piece is you know, being balanced in your life, having a good diet and having good exercise, of course, is very important, but balancing that with things that make you happy and getting rest and doing things that you enjoy doing. So it's a lot when you try to do all those things and put that all together, and I understand that, and it's not something that we can all change overnight, but I think it's the key for long-term success and happiness with your with everything in life.
Great, thank you so much, Tom, and I'm just gonna sign off and give me a couple seconds.